Jessica Carter's video, and today I'm going to be talking with my client. Her name is Rue Bennett, pronouns she, her, and hers. She's a 16-year-old biracial female. Her father passed away last year due to cancer. Rue has generalized anxiety disorder and an opioid substance misuse disorder. This is the second meeting for Rue and I. In her last meeting, she told me the narrative of her life from her perspective. She blames herself for her problems like being anxious, depressed, and for her substance abuse. I want to use a postmodern intervention called narrative therapy to help her change the story she has about herself, more specifically externalization. And so she has goals of coping with anxiety without substance abuse overall. Her current thought patterns include things like, I'm just another drug-addicted teen, my mom hates me because I'm a druggie, I'm too anxious for anyone to be around me all the time, and I'm just depressed all the time ever since my dad died. So we are going to start now. Hello, Rue, how are you doing today?
Well, I'm okay.
Yeah. If you can say, if you could pick one word to describe how you feel today, what would you say for today?
I feel sad.
Okay.
I feel sad.
Okay, we can sit with that. The words that, thank you for sharing that with me. The words that we use to describe ourselves and how we feel can have a major effect on our outlook in life. So today I wanted to kind of do something on the same note. I want us to look at maybe some of the language that you might be using to talk about yourself, or in some of the things you said from our session last week, to see if there's anything we can change up that might be causing ourselves some extra pain. Is that something you'd be willing to try today?
Yeah.
So it's something called narrative therapy.
Okay.
More specifically, we're going to be using something called externalization. So we're going to be saying some of these things out loud and then maybe working together to see how we can change some of those thought patterns. Is that still okay?
Okay, yeah, that sounds good.
Okay, so would it be comfortable for you if I gave you an example first, and then maybe we can walk through the next few together?
Yeah, I think that would really help.
Okay, yeah, great. So let's see here. So let's try some examples from your story last week. Last week you said, I'm too anxious for anyone to want to be around me all the time. So when I hear that, it makes it sound like you think that you are the anxiety, when really you're here and the anxiety's over here. So you want to kind of change that so that you have you have more power over that anxiety. So we got to separate you from that first. So I would say instead, maybe I am Rue. I am a person who experiences anxiety. Do you see how that kind of feels better to say?
Yeah, definitely.
Does it? Okay. All right, great. So let's try another one, and maybe you can help me out with this one. So something else that you said from last week was, I'm just depressed all the time ever since my dad died.
Mm-hmm.
So that's a heavy one, I know.
Yeah.
And so how do you think you might change that one around?
I think that maybe another way I could say it is that I feel depressed. Well, that because of my dad dying, it makes me feel sad.
Yeah.
Or depressed.
Yeah.
Or just upset.
Yeah, for sure. Or maybe I experienced depression because I had, my father passed when I was really close to him.
Yes.
And so that's just basically saying that you aren't depressed as a person, and that, it's natural to feel sad over losing those ones, but doesn't mean that that's all you are. So you did a really good job. It takes a lot of courage to do this kind of work, so I'm proud of you for trying. Do you feel comfortable sharing a couple more, or trying a couple more? Okay, let's see what else we have. So another one we had was, I'm just another drug-addicted teen. So what do you think about that one?
Well, it's a little bit hard.
Mm-hmm.
So rather than kind of make it about myself,
Mm-hmm.
I would say that I'm a teenager who is experiencing addiction.
Yeah, that's really, really good.
Okay.
So instead of you are a drug addicted teen, you're
Mhm.
somebody that's, working through their sobriety, trying to reach that
Yeah.
too as well. So you're in recovery. So maybe like even throwing in the recovery piece because you're working so hard towards that goal too, to kind of take away from. So instead you can just, I'm Rue, and I've had a hard time, and I've experienced, some of these bad things, but I'm working towards, So I'm
Okay.
really proud of you. That's a good one. So we'll do just one more today, and this one, I know it came up a lot in your first session, and so this one is, my mom hates me because I'm just a druggie. So how do you feel about that one? How do you think we can reframe that?
That one's also a little difficult.
Yeah.
Um,
These are all really deep, so you're doing really well with these.
Thank you. Maybe that my mom doesn't hate me. She just doesn't like that I use drugs.
That's very, very, very good. Yeah, that's how I would have framed that one too, is that she doesn't hate you at all. She just hates the drug usage and maybe the things that that they might be doing to you, or doesn't like to see you, in pain.
Yeah.
So that kind of, see how that kind of just separates you from your addiction, and especially involving your mom.
Yeah.
So that was really good. So that's a really good example of of that technique, exactly. So externalization. So that's something that we can kind of keep track of to see how you're doing.
Okay.
And let me see here. And so there's another. So there's another one. So this one is. So this is another kind of separate activity, but within the same realm of narrative therapy. And this is just a simple activity just to see. So I'm going to ask you a question, and just, in a short story, tell me. So this is to tell your story where you're a hero instead of a villain. Because I know a lot of those statements that you said before and that we discussed in, your previous sessions, is that you really kind of think that you're the villain of your family. With your sister and your mom ever since your dad passed. So how would you, like, as of right now, you're going through therapy, you're attending your meetings twice a week, you're doing well in school again with your attendance. So instead of saying things like, I'm just a drug addict, or nobody likes to be around me, what are some things that you would, so if you had to be the hero in that story instead of the villain, what are some things you think you might say about yourself?
I would say that I'm trying to stop using drugs, and so I've really worked hard and kind of went to all my meetings, and I've really learned how to kind of fight drug addiction.
For sure.
And that alone kind of makes me feel like a hero.
Definitely.
And the same for school. Going to school and actually getting decent grades now, I think that also is something different for my family.
Yeah.
So in their eyes, I hope that they see me as a hero of being able to overcome these challenges.
Yeah, for sure. That was really good. I hope they do too, because I definitely see you that way. Like, again, it takes so much courage just to even come here, to show up. I know you don't even have to show up through the door. So just for putting in that effort for change for yourself is huge. So you've already made some really good progress. Yeah, of course. So I do have kind of in the same line with what we were doing today, just kind of like changing up how we talk about ourselves, even in our own heads. I have a homework assignment for you to bring back next time we meet. And so this one is trying to be just, it's about keeping a journal, basically. So you're going to be doing some journaling. So anytime you catch yourself saying, something in your head, kind of like what we were discussing today, like, nobody wants to be around me because I'm just so depressed all the time. Anytime you catch yourself saying anything, about yourself in your head, try to catch yourself.
Okay.
Write down what you said, and then on your own, try to reframe it underneath.
Okay.
And then just really kind of focus on on that more positive side. And then when you come back, we'll kind of look at the patterns, and if you get stuck on any of them, we can kind of try to work through that together. Does that sound comfortable?
Yeah, that sounds great.
Okay, great. Well, our time is up. Thanks for coming in today.
Thank you so much.